CMS and drug manufacturers have negotiated prices for certain drugs, which take effect on January 1st, 2026. This price is called the maximum fair price. Manufacturers are responsible for making this price available. Those prices will be in place for people who have prescription drug coverage under Medicare Part D. Implementing these new negotiated prices presents a new need for data and payment exchange in the pharmaceutical supply chain. In the current supply chain structure, pharmacies and manufacturers lack an existing direct connection in order to exchange data and payments. The Medicare Transaction Facilitator is a free, secure, web-based platform created by CMS with the purpose of making that connection. The Medicare Transaction Facilitator provides two key functions. First, it provides manufacturers with access to certain pharmacy claims data so they know which pharmacies are dispensing their drugs under the negotiated maximum fair price and how many dispenses of those drugs are being processed every day. This data is crucial for manufacturers to have so they can make additional refund payments if needed to the pharmacy to make sure they have access to the negotiated maximum fair prices. These refund payments will accompany the payments pharmacies receive from Part D plan sponsors for dispensing drugs with negotiated maximum fair prices under the Part D program. Second, for manufacturers who opt to use it, the system will also provide functionality to pass these refund payments to the pharmacies dispensing their drugs. To be ready for the upcoming implementation of this program, pharmacies need to enroll in the Medicare Transaction Facilitator. Enrollment is targeted to begin in early June 2025. CMS will provide step-by-step directions to support pharmacies through a straightforward enrollment process, even providing an opportunity to use existing information from other pharmacy databases to help speed things along. CMS encourages pharmacies, mail-order services, and other places where patients get their prescriptions and are participating in Part D to enroll as soon as possible to be sure you are ready for initial negotiated maximum fair prices taking effect January 1st, 2026. Among other functionalities, the Medicare Transaction Facilitator will allow pharmacies and clinics to express their preference to receive maximum fair price refund payment through an electronic transfer to their bank account, a paper check, or through a third-party support entity like a pharmacy services administrative organization. Based on the manufacturer's approach, these payments may be processed either by the MTF or by the manufacturer directly. Receive data to support with reconciling payments. Review manufacturer maximum fair price effectuation plans, which describe the manufacturer's approach to making the MFP available to pharmacies once available. Submit concerns to CMS about maximum fair price availability using the Complaints and Disputes functionality starting in January 2026. For more resources and support in enrolling in the Medicare Transaction Facilitator, please visit the Resources for Pharmacies and Dispensing Entities webpage on cms.gov. This product was produced at U.S. taxpayer expense.